Hi, my name is Jacob Holt. I'm a physical therapist with Applegate. Congrats on your new hip replacement. I'm sure you're working on making your way home and getting settled in. I just want to review a few precautions for your surgery. Your surgeon should have explained if you're getting an anterior, a lateral, or a posterior hip replacement, and each precaution or each surgery has a different set of precautions. It's nothing to stress about. The goal of using these movement precautions are to prevent dislocation and complication with your surgery. The biggest thing that you're looking to get to is 6 weeks after surgery. That's when the bone is typically healed from the traumatic surgery that you had. So we want to take it easy. The biggest thing you want to do is follow up with your surgeon about weight-bearing precautions. If you're 50% weight-bearing, your biggest thing is not stepping up on stairs with that surgical leg. You should be using a walker or crutches, whatever feels more comfortable. I prefer a walker just because it's harder to fall and mess things up. So we'll start with the anterior approach first. The anterior approach is a little bit better in the post-op because it's harder to dislocate. There's some indications that you would do a different surgery, but we'll just cover the anterior approach for now. Typically, there'll be an incision here on the front of your hip. The biggest things you want to avoid are extending your hip too far behind you, as this puts pressure on the incision, turning your toes out excessively or inaccessibly, bringing your knee past 90 degrees of hip flexion, just like this. You also want to avoid crossing your legs, as this can put a lot of pressure in the front of your hip. When you're sleeping, you don't want to cross your legs down here either. What I typically recommend for patients is that when they're sleeping, try to sleep on your back the first few days. You can put some pillows between your legs. I would recommend not sleeping on your side, as this can put a lot of torque and pressure on your hip. Second replacement is a posterior replacement, where they go through the gluteal muscle in the back. As opposed to the anterior replacement, where you're putting you want to avoid this. For the posterior, you want to avoid leaning forward like such, or flexing the hip up, as this will put a lot of pressure on the muscle behind. That's pretty much it. The anterior replacement covers a lot of the precautions in the posterior replacement. Most importantly is crossing your legs, going to excessive ranges of motion, and turning your toes in or out. So when you have your walker, just make sure you keep your toes pointing straight at all times. If you're turning, turn slowly so that your toes face your shoulders. Aside from that, it's pretty simple and straightforward. The biggest exercise for you in your rehab is going to be walking, at least until 6 weeks post-op. I look forward to seeing you. Thanks.